What is CAR T-cell therapy for DLBCL lymphoma? Imagine a treatment that turns your own immune system into a targeted fighter against cancer. That's what CAR T-cell therapy does for certain types of non-Hodgkin lymphoma, especially diffuse large B-cell lymphoma. This aggressive form of lymphoma can sometimes come back after treatment or not respond to standard therapies. For those patients, CAR T-cell therapy offers a new hope. To understand CAR T-cell therapy, it helps to know a bit about how the immune system works. T-cells are a type of white blood cell that normally help fight infections and cancer. In this therapy, doctors collect a patient's T-cells from their blood through a process called leukapheresis. These cells are then sent to a lab where they are genetically modified to produce special receptors called chimeric antigen receptors, or CARs. These CARs are designed to recognize a specific protein called CD19, which is found on the surface of B cells, including the cancerous ones in diffuse large B-cell lymphoma. Once the T cells are engineered to have these CARs, they are multiplied in the lab to create a large number of active fighters. Before the modified cells are infused back into the patient usually receives chemotherapy to reduce their existing immune cells. This step helps the CAR T cells expand and work more effectively once they are reintroduced into the body. After infusion, these CAR T cells circulate through the bloodstream, seeking out and destroying cancer cells that carry the CD19 protein. This therapy is approved mainly for patients whose lymphoma has relapsed after previous treatments or did not respond to them. Clinical studies show that CAR T-cell therapy can lead to long-lasting remissions in a significant number of these patients. For example, about 40 to 50% of heavily pretreated patients have experienced complete responses, with some maintaining remission for years. However, CAR T-cell therapy is not without risks. The most common serious side effects include cytokine releases syndrome, which can cause high fever, low blood pressure, and breathing difficulties. Neurologic toxicities like confusion or speech problems can also occur. While these side effects can be severe, they are usually manageable with prompt medical care. Because of these potential complications, the therapy is typically administered at specialized centers with experience in managing such side effects. The process of getting CAR T-cell therapy involves multiple steps. After collection, the cells are engineered and expanded over a few weeks. During this time, patients may undergo additional treatments to prepare their bodies. Once the CAR T cells are ready, they are infused into the patient, and close monitoring begins. Patients are watched carefully for side effects in the weeks following treatment, and supportive care is provided as needed. Research continues to explore ways to improve CAR T-cell therapy for diffuse large B-cell lymphoma. Scientists are studying its use earlier in the treatment process for high-risk patients and combining it with other therapies to boost effectiveness. These investigations are ongoing, and while promising, they are not yet part of standard treatment. It's important to remember that not everyone with diffuse large B-cell lymphoma is a candidate for CAR T-cell therapy. Factors like overall health, previous treatments, and specific cancer features influence eligibility. Decisions about this treatment should always be made in consultation with a healthcare team experienced in lymphoma care. In summary, CAR T-cell therapy is a groundbreaking approach that uses a patient's own immune cells to fight lymphoma. It offers hope for long-term remission in cases where other treatments have failed. While it carries risks, it has already changed the outlook for many patients with this aggressive disease. As always, talking with a healthcare professional is essential to understand if this therapy is right for you and to get personalized medical advice.